Patient-reported outcome measures, what they are and why they matter. What are patient-reported outcome measures? PROMs are standardized tools or questionnaires used to measure outcomes that matter most to patients, such as the quality of life and other subjective experiences during and after cancer treatment, complementing clinical metrics such as survival and recurrence rates. They capture the direct feedback from patients on how they feel or function in relation to their health condition, without interpretation by clinicians or others. Examples of domains captured by PROMs are physical symptoms, emotional health, such as anxiety, depression, or fear of recurrence, social functioning, that is the impact of cancer and its treatment on social roles and relationships, functional ability, that is how cancer affects daily activities, mobility and independence, and global quality of life. Why are PROMs important? PROMs are crucial because they capture aspects of a patient's experience that clinical measures alone cannot fully reflect. They provide a patient-centered view across the cancer care continuum from diagnosis to treatment and survivorship. Key objectives of PROMs are understanding quality of life. Since cancer treatments can significantly affect quality of life, PROMs allow understanding whether a treatment is worth the side effects, even if it improves survival. Fostering shared decision-making. Patients and clinicians can use PROMs to make better informed decisions about treatment options based on both clinical effectiveness and patient preferences. Monitoring disease symptoms and treatment tolerability. PROMs can highlight issues like unmanaged pain, fatigue, or emotional distress, helping oncologists address side effects in real time and adjust treatments as needed. In short, they allow to personalize cancer care. By capturing individual patient experiences, treatments and care can be tailored to meet specific needs, improving both survival and well-being. How can PROMs be used? PROMs provide a multi-level approach to improving the quality of healthcare, with each level contributing to better health outcomes, system efficiency, and appropriate use of resources. PROMs are increasingly being used at three interrelated levels of healthcare systems. At the micro level, PROMs are applied in the context of individual patient care to make informed clinical decisions, tailor treatments, and engage patients in their care. At the meso level, PROMs are employed within healthcare organizations like hospitals, clinics, and health systems to evaluate the performance of healthcare institutions, improve service delivery, and drive quality improvement initiatives. At the macro level, aggregated PROM data are used for policy development, health system evaluation, and large-scale decision-making to inform national health strategies, fundings, and quality frameworks. While PROMs are essential tools for capturing patient perspectives and improving care, there are barriers that impact their effective use at each of the three levels. For example, challenges at the micro level include patient understanding and engagement issues, patient burden in completing the questionnaires, clinical workflow disruption, lack of immediate actionability of data, confidentiality and privacy concerns. Barriers at the meso level include administrative and workflow burden, difficulty translating data into meaningful quality improvements, skepticism of clinicians, lack of resources to manage, analyze, and act on PROMs data, and inconsistent use across departments. Challenges at the macro level include difficulties in data standardization and comparability, high costs for developing infrastructure for data collection, difficult integration of PROMs into existing health systems, underuse or misinterpretation when making high-level policy decisions, and underrepresentation of certain populations. Addressing these challenges is not easy and requires collaboration across all levels to ensure that PROMS data are not only collected but also used wisely to improve patient outcomes and healthcare quality. However, the benefits of PROMs are worth the effort. In fact, their systematic use leads to a more patient-centered, effective, and accountable healthcare with improved outcomes at the individual, organizational, and societal levels.